Hi, everybody. Thank you so much for joining today. Whether you're a provider, a home visitor, a doula, a nurse, or anyone supporting families during pregnancy, you play a critical role in improving birth outcomes. And I'm so grateful for the work that you do. Today's session is designed to be a quick refresher on Count the Kicks, an evidence-based, easy to implement tool that helps expectant parents track fetal movement and recognize when something might be wrong. Today, what I will do is go over in about 20 minutes or less what the why behind Count the Kicks. I will offer key talking points that you can use in your daily work, and I'll share a few reminders about how best to support families in using this tool. If you are interested in diving deeper and learning more about how to bring this into your setting or joining our champion program, I'd love to connect with you after this session. My contact information is on the screen here, and you can always email me for additional questions and feedback and other outreach opportunities. Again, I can also share additional training opportunities, materials, and tools to support your work. So let's go ahead and let's jump right in and reconnect why Count the Kicks can make such a big difference. First, what is stillbirth? Stillbirth is the loss of a baby at or after 20 weeks of pregnancy. Globally, we lose around 2 million stillbirths occur worldwide, and nationally, around 21,000 babies are stillborn every year in the United States. So that's about 65 babies a day. So really, the why behind this is to work on preventing those preventable stillbirths, which about a quarter of stillbirths are preventable, and that we know the power of education. We know the power of this program because this is a highly effective evidence-based stillbirth prevention program. 15 years ago, we developed a proven early warning system for expectant parents, and we have saved lives in over 30 states and in 5 countries so far. This program is easy to implement and to share with your expectant parents. So, we're going to jump right in on how to have this conversation and how to talk about Count the Kicks with the expectant parents that you serve. So, why does this matter? Again, movement is one very important way a baby can communicate before birth. A change in a baby's movements can be an early sign and sometimes the only warning sign that a baby may give when in distress. It's just like when you and I are not feeling well, we change our activity level. We might be sleeping on the couch or in bed. We're conserving our energy because we are sick. We don't feel well. Same with baby in utero. If something is going on with the baby inside, whether it's an umbilical cord, a infection, the baby's movements will change and become weaker. And so that's why it's so important to start tracking your baby's movements in the third trimester. So ACOG, which is the large Academy of Obstetrics and Gynecology organization, recommends beginning counting at 28 weeks or 26 weeks if your expectant parent is considered high risk or pregnant with multiples. So right at the beginning of the third trimester, we want you to share with your expectant parents that they should be tracking their baby's movements. And it goes beyond just asking, have you felt baby move? It's questions like that are open-ended, such as, let's talk about your baby's movements. What questions do you have about your baby's movements? Let's talk about why we should be doing this. So a roll, a kick, a jab, a swish, a push. Those are all the types of movements that we want to be monitoring as expectant parents. So when you're having this conversation with expectant parents, and while we're called Count the Kicks, it goes beyond that, right? Like it's any of those movements that I just referenced, except for hiccups. Hiccups are involuntary and do not count towards a movement count. Hiccups are similar to breathing. And so, because it's involuntary, they don't count towards a movement count. If you are working with an expectant parent and they say, "Oh my goodness, but how do I tell if it's a hiccup or not?" I think you can explain in my how I do it is I explain that hiccups are very rhythmic and consistent and usually last, a minute or two, and then they might stop. So that's kind of how I explain what a hiccup is versus a movement. So, this is how you have the conversation. 5 easy steps. This is how you can educate expectant parents on how to pay attention to their baby's movements. So you can read this slide as I go through it. This is available on our website for easy reference as well. And so all you do is in the third trimester or gearing up to the third trimester, I want you to have a conversation and say, hey, I want you to track your baby's movements. Here is a simple and easy way to do this. I want you to do this because I want you to become familiar with how often your baby moves and how long it takes your baby to move. Here is a free tool if you want to share the app with your patients and expectant parents, or we have paper kit counting charts. Regardless of the way of counting, the most important thing is I want you to do this every day around the same time. So I want you to pick a time that works best for you or when baby's most active. Maybe your baby's really active at 10 o'clock at night, and that's a good opportunity for you to sit down and focus on baby because everybody else is asleep finally. So every day around 10 o'clock at night, you're going to pull out the Count the Kicks app or your paper kick counting charts, and you're going to choose that first movement you want to start with and set the timer. And then you're going to take time how long it takes your baby to get to 10 movements. And you're also going to rate and pay attention to the strength of those movements. So after a couple days, you will start to see the average length of time it takes your baby to get to 10 movements. A pattern starts to emerge. And I want you to call your provider, or if you are the provider, to call me right away or go in right away to your nearest OB triage, ED, if you have changes, significant changes in your movement, or you have questions or concerns. As those individuals like you who are working with expectant parents, being able to communicate that you want to hear from your patient if they have any sort of concern is key. Let them know you're there for them. Hospitals are open 24 hours, 7 days a week. So just ensuring that they know that you want them to be that you want to be contacted if they have concerns. But the whole goal of this program is to empower and educate individuals so they know when to go in because they're going to get to know what's normal for their baby and know when those changes happen. So that way it lessens the calls that you might get and you ask people, well, when did your baby last move? And they say, I don't know. This is a way for them to have data in their hands to say, this is not my baby's normal or this is my baby's normal. So, what I want to do now is just briefly talk about our Hallmark tool, which is our free kit counting app. And what I'm going to do is I'm going to play this video as I'm talking. And this is a way for you to see the app in action, but also hear how I'm explaining it in my own words. So, go to your app store right now as you're watching this, search Count the Kicks if you haven't downloaded this app and download it. And I want you to register. I want you to start using it so you can see how easy it is to use. And so how it works is you register, so enter your email address and zip code, and then pick a day, pick a time every day in the third trimester and start counting. So you saw me tapping on that footprint right there on the screen before this. I started tapping that footprint every time I felt baby move, roll, push, jab, swish, any sort of movement, again, except hiccups. So you can run this through with your patients. You can have them practice it in the waiting room while they're doing the gestational diabetes test and have them come back and ask questions. So I'm tapping, the timer starts automatically. You can undo a kick if you got a little tap happy there. And then you rate the strength. After you get to 10 movements, you rate the strength of those movements. You can also add additional notes. So if they want to keep like a mini diary. And what's really cool about this app is you can download all this data as the person using it, and they can share it with you as a provider or a doula or a home visitor. You can say, hey, it's been a week since we met. I would love to see your graph. How's the counting going? What questions do you have? You can set daily reminders within the app. It's available for the iOS and Android and on the Apple Watch. And we also have a web-based kit counter as well. There's just a lot of great, cool features. One feature that I want to especially highlight on this slide in particular is that we have a find help resource. If you click on the My Zone, which is at the very bottom right-hand corner, there is a resources section and you can access Find Help, which is a way to search by zip code free and reduced cost services near you or near your expectant parents. So this is our free Hallmark tool. really easy to use and understand. And I want to take the next couple slides to walk through some of the newer features that were added within the last 6 months. And so, one of those features is a contraction timer with simple instructions. This is feedback that we got from expectant parents using the app and providers. We listen to the community. We want to make sure that this works for you like you need it to work. And so, some of the feedback we got was they wanted a contraction timer as well as the kick counter so that they had a one-stop shop for these great resources. So, we have that. We also have the ability to scan printable charts, which I'll tell you a little bit more on the next page. We have digital badges. You can see those in the gray over there. Once you get a digital badge, such as filling out a survey or doing 100 kicks, you get those badges to light up and you can share those. We also have dark mode now, and then a lot of cool new features on the My Zone feature aspect here, the section of the app, where you can also add an image to your profile. This is the dark mode example that you have. So a lot of people have asked for this, so we were happy to get that on the app for them. And then the digital tool here that you see here is the ability to take one of our paper counting charts, which are available on our website. And you can scan, if you've been filling out a paper kit counting chart, you can scan it and upload it into the app, and then it will go into that graph. So let's say, for example, you are a home visitor or a doula and your client does not always have access to Wi-Fi to be able to count, but they can count using our paper kit counting charts. So then maybe the next time you see them, you can say, let's scan your charts so we can easily see the trend on a graph as well. So it's just another way that we can ensure people have lots of different ways to access our material and education. I'm also really excited to share one of the newer features on the app within the last year is our Ask Anna feature. This is our AI assistant. We recently launched Anna in September 2024. And how it works is people can access Anna on our app or our website or through our social media and ask fetal movement monitoring questions and get evidence-based answers in real time. Anna responds from curated research that we have collected and provided from our medical advisory team and shared with the app developer. So Anna is not pulling in answers from Dr. Google or TikTok or anything like that. On this next slide, I kind of go into more detail of a visual of how to use Anna. This is how it looks on our website. So you can simply ask your question right there. It introduces herself and what she is and how she works. And if you scroll down, that you'll see in a minute, you can see the research that we have collected so far to be added into Anna. It's machine learning at its best for public health consumption to improve outcomes. Just an easy way for people to get evidence-based answers to simple questions like what is a hiccup or how does a hiccup count? So those are just some of the research pieces that we've selected to be used in the Anna tool and some sample questions that can be done. So I wanted to make sure to share that. The app is in over 20 languages. Anna is in over 10 languages. We continue to add languages to each of our tools as services align and funding and things like that. But that's kind of where it's at right now. There's also citations on all of Ask Anna's answers, so you can easily see where the research is coming from. I wanted to just briefly mention the fact that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. So this does not increase anxiety. It increases bonding. It's a way to also include significant others. They can also join the profile that is set up on the app to say, "Hey, let's count our baby's movements, include siblings, include others. We can all be part of this experience by tracking my baby's movements. So let's do that together." And this is sweet little Mabel, and I like to flag her story where her mom says, the only red flag that there was a problem with the pregnancy was my daughter's change in movement. I am so grateful I had concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for my baby. All moms deserve to have this knowledge so their babies can have a healthy birthday too. So this is what we talk about when we say our baby safe stories, our success stories. We want to hear from you if you have any stories like this where you've shared Count the Kicks, you've educated on it, and they come back and say thank you. Like this is what saved my baby's life. If you're a healthcare provider, same thing. Like we want to turn those why didn't I know? Why didn't I know about this tool? Why did I know I should be tracking my baby's movements in a standard way? To I'm so glad I knew. Everybody should know this. So I went over the app fairly quickly, but I think one of my highest recommendations, you'll see this at the end too, is to download the app and to use it to make sure that you register, make sure your clients and patients register on it. They'll get a little bit more tools that way. But I think I want to switch directions here and talk about some of the common questions we get or hear about and how you can respond to those from your patients or clients and expectant parents. One of the most common ones I get probably every single day that I work is my baby should get 10 kicks in 2 hours. You see that unfortunately on the internet. You might hear it from a provider or a friend that I was told I should get 10 kicks in 2 hours or 10 kicks in 1 hour. And I think the way we would recommend responding is, every baby is different, and the recommendation to expect 10 kicks in 2 hours is actually outdated. Current research indicates parents should work to understand the normal amount of time each day it takes their baby to get to 10 movements. There is research on our evidence page of our website where you can read that research as well. And so what we want to educate on, what we want you to educate on is the importance of getting to know what's normal for your baby. My baby might take 15 minutes to get to 10 movements, and my friend Sarah's baby might take 30 minutes to get to 10 movements. She knows that 30 minutes is her normal because she's been counting around the same time each day. And I know about 15 minutes is my normal. So it's really important to get that trend, to get that average amount of time it takes your baby to get to 10 movements, to get to know and understand your baby. I would say the second common question that we get quite a bit is I was told that if my baby wasn't moving, I should drink something cold or eat something sugary. I have recently also been told that we should put ice cubes on bellies to get baby to move. So again, research has moved away from the idea that sugary drinks and other interventions like ice cubes, temperature change, are not a good way to get baby to move. Kick counts are best monitored without those interventions because again, if baby's not moving like normal, parents should speak up to their provider right away. They should be encouraged to speak up. And again, why are we trying to force baby to move by these interventions if they're not moving like normal? So that's another on our evidence page. So now, before I wrap up in this very brief and quick overview, is I just want to put some reminders of how you can encourage your expectant parents that you serve to be a champion and that you're a champion for them too, and encourage them. They are their baby's advocate. No one knows their baby's movements better than them. So ensuring that you are encouraging them to trust their instinct and speak up if they feel like something's off and letting them know, and just so we all know and let your colleagues know, we count the kicks saves lives. Monitoring your baby's movements daily can help detect early warning signs and improve outcomes. The picture you see there is baby Eva in Kansas. She was saved by Count the Kicks because her mom noticed a change in her baby's movements and spoke up, and she is here because of it. Knowledge is power. I am a firm believer in this. Using the Count the Kicks app and tracking the method gives you the data to share with your provider, helping them make informed decisions. I'm really big, and Count the Kicks is really adamant about that shared decision making. You are a team with your expectant parent as the medical team, as a doula, as a home visitor. So knowledge is power. It helps build confidence knowing their baby's movements. They don't have to second guess things. One of the other common questions I get is from parents saying, "Oh, my baby's always active. It's like a jungle gym in there." And I always say, "That's amazing. A healthy baby is an active baby, but it's still really important to know if your normally active baby has slowed down. And sometimes that can happen without any other signs. So we want to make sure that we're tracking those babies that are using your insights as a jungle gym as well. Also, sharing that their voice matters. Don't hesitate to communicate concerns with their provider. You deserve to feel heard and supported. And as providers who might be listening today too, encouraging that you want to hear from them if they have a concern. That is what you're there for. Asking questions, letting your expectant parents know it's totally okay to ask provider next steps, tests, or monitoring. Again, back to that shared decision making, providers should expect that too. You're not alone. We are a large community working together to improve pregnancy outcomes and support parents. So go to our website, check out our socials, and again, understand that just spending a few minutes each day tracking kicks can make a significant difference in your baby's health. And also, this takes 3 to 5 minutes to talk about with your expectant parents. I would reiterate, especially if you're a provider listening today, that you want to be talking about this every single time you see them in the third trimester. If you're a doula, every single time you see them, you should be talking about it. If you're a home visitor, you should be talking about this multiple times a day, or a time that you see them. So, next steps that I would love for you to do is to take time after this review and download the app, register, set your reminders, see how easy it is to use, and then share this with your expectant parents. And then other next steps is, of course, become familiar with the app, like I just talked about. Order our materials. In a lot of our states, our patient education materials are free or low cost. So visit the website, click on order materials, and click on your state and fill your shopping cart. Take the time to educate. Again, make sure you have this conversation at every touch point in the third trimester. Making sure everybody knows about this, since this is a quick overview and refresher. If you need us to come in and do a longer presentation where we can do more on the history of fetal movement counting and the data, happy to do that. Debunk misconceptions and encourage speaking up. And then remember, hours and minutes matter in preventing stillbirth. So, educating patients and clients and staff on how to expedite concerns of movement. Some resources that I wanted to mention today as well is one of the biggest ones here is our connection with the Association of Women's Health Obstetric Neonatal Nurses, the largest labor and delivery nurses across in the country. We worked with them on a research project to create a standard of care of what to do when somebody comes in with a change in fetal movement. So this course has been piloted, the algorithm has been piloted, and you can now access this training for $65 for A1 members and $80 if you're not. There's also bulk pricing for larger groups. Just contact me for that information. At the bare minimum, though, I highly, highly encourage you to take this training. You will get access to the algorithm that has been researched and piloted that walks you through the standard of care of what to do. This helps eliminate inconsistencies in care. It helps ensure patients receive clear, evidence-based education. It provides clinicians with structured guidance and decision making, and it supports institutions in training and implementation. So please, please go to this. This has been a huge project in the making and has systemic change that will improve outcomes across the United States. Those patient education materials that I talked about, again, you can scan this QR code, or if you're already on our website, just go and click on order materials and click on your state. We have a lot of different options depending on the state that you're in. All materials start out in English and Spanish, and then depending on your state, you may have additional languages as well. So be sure to check that out as well. That can help when you're having this conversation with your patients and clients. And then new this year, we launched our Count the Kicks doula guide to count the kicks. So if you're a doula listening today, I highly encourage you to also access this doula guide that has a training embedded specifically for doulas too, where we go into a little bit more detail about the kind of the doula conversation that you might have with your clients. And so I encourage you to check out that document and training too. We also have a digital resource that you can access on our website. You can share this clicking the More button there. It's in available language in these available languages currently, and we continue to add to those. So 100% keep checking our website, order the materials, download the app, simple, easy tools to improve outcomes where you're at. And so together we can help reduce preventable stillbirths through early detection and patient empowerment. And these are just some of the babies saved with our program. Thank you so much for joining me today on this very quick refresher on Count the Kicks and implementation. If you have any questions, feel free to reach out to us. Happy to have longer conversations of what this could look like. If you need additional help standardizing this in your health system, WIC, home visitor, please reach out. And thank you so much for all that you do in your state to improve outcomes.